Ladies and gentlemen, World Hypertension Month alerts all medical practitioners to the importance of proper diagnosis and effective treatment. In our commitment to public health and professional service, IPCA proudly presents a daily take-home message throughout this month. These insights are provided by the eminent Padmashri Dr. C. Venkata S. Ram, a global legend recognized for his pioneering contributions to our understanding of hypertension. Listen to Dr. C. Venkata S. Ram's today's message.
Greetings to my fellow medical practitioners all over the country. In connection with World Hypertension Month of May, the message for today is on hypertension in pregnancy. In the last few days, we have covered uncomplicated hypertension. We have covered hypertension complicated by chronic kidney disease. We covered hypertensive emergencies. Today, we are going to cover a very special group, namely hypertension in pregnancy. In normal pregnancy, the blood pressure goes down. All normal pregnancies are associated with a drop in blood pressure. Any increase in blood pressure in pregnancy can cause serious complications. So when you see a patient who has hypertension in pregnancy, it is a very serious condition. It has to be diagnosed and treated properly. New onset of hypertension after 20 weeks of pregnancy is called gestational hypertension. So when you see hypertension after 20th gestational week, it is called gestational hypertension. When you see hypertension before 20th week in pregnancy, it is called chronic hypertension. So chronic hypertension is when you see elevated blood pressure before 20th gestational week. When you see hypertension new onset after 20 weeks of pregnancy, it is called gestational hypertension. Sometimes chronic hypertension and gestational hypertension can be confusing, but when you see new onset of high blood pressure after 20th week of gestation, it's a potentially serious condition. It has to be diagnosed properly. It has to be treated properly so that you protect the mother and the fetus. So hypertensive disorders in pregnancy can be very serious, especially gestational hypertension occurring after the 20th week of gestation. Make the proper diagnosis, and there are guidelines provided by both various medical organizations, including organizations which deal with obstetrics and gynecology. There are specific guidelines on how to diagnose hypertension in pregnancy and how to treat hypertensive disorders in pregnancy according to the guidelines. I would refer you to those guidelines. The only comment I want to make is elevation in blood pressure in pregnancy should be taken very seriously, particularly in those women who develop hypertension after the 20th gestational week. And you please follow the guidelines on what goal should be achieved and what drugs can be used in the treatment of hypertension in pregnancy, because you have to protect two individuals, the mother and the baby, and that is the reason why it requires special medical care as a team between physicians and obstetricians to reach the recommended goals to protect the mother and the baby. Very important condition, hypertension in pregnancy. I would refer you to the guidelines provided by the special societies on managing hypertension in pregnancy.